Our presentation was looking at patients with mantle-cell lymphoma, which is an uncommon subtype of B-cell non-Hodgkin's lymphoma. And typically in this disease, for patients who are young and fit, one of the standard treatment approaches would be incorporation of rituximab and cytarabine containing induction therapy, followed by a consolidative autologous stem cell transplant. Based on data from international clinical trials, this has sort of been an established treatment paradigm for that population. But despite that aggressive treatment approach, unfortunately, for mantle-cell lymphoma, it's still an incurable disease for many patients, and the outcomes are varied. Previous studies have explored the impact of early disease progression on overall survival, particularly in other subsets of non-Hodgkin's lymphoma like follicular lymphoma and large cell lymphoma. And in our study, we wanted to sort of evaluate that impact and the clinical significance of the timing of relapse following auto and its impact on overall survival within a population of patients with mantle-cell lymphoma. And so in order to tackle that issue, we utilized the CIBMTR database to evaluate the effect of post-auto time to relapse on overall survival over time. And within the study, we had about 460 patients who all underwent auto within 12 months of diagnosis. Within the analysis, we were able to look at a number of different things. We were able to perform a dynamic landmark analysis at 6-month intervals, spanning 5 years following their auto transplants. And the aim of that was to evaluate, again, the impact of time to relapse on overall survival by also giving us a chance to adjust for significant patient and disease-related variables. Through our analysis, we noted that the impact of relapse on overall survival was really greatest in those patients relapsing early after their autologous stem cell transplant, which sort of makes intuitive sense. Particularly those patients that relapsed at the 6, 12, and 18-month landmark time points had poor overall survival. And through our analysis, we found that 18 months was really the optimum cutoff point to define those patients that relapse early and have the poor survival versus patients that relapse later and have more favorable outcomes. And so some of the other things that we I would say concluded from our analysis is that, essentially early relapse does define this high-risk group with inferior post-relapse overall survival. And those patients that relapse after 18 months, their overall survival is overall quite favorable. And we found within the context of our study and within the population we evaluated that the overall survival was ranging between about 44 to 67 months. And so, our data essentially confirms this trend that the time to relapse in mantle-cell lymphoma is a dynamic marker, which extends our ability to provide accurate risk assessment to our patients and to better define optimal management strategies. And particularly, we would consider those patients that relapse early after auto transplant for novel therapeutic approaches like clinical trials or more so CAR T-cell therapy.